to our comprehensive guide on the proper sterilization of dental instruments. In the world of dentistry, ensuring patient safety and preventing the spread of infections are paramount. Today, we delve into the crucial steps and protocols required for effective instrument processing and sterilization. Effective dental care hinges upon the meticulous handling of instruments. From the moment a tool is used, its journey through processing is vital. Thorough cleaning, inspection, and packaging are fundamental steps. Proper instrument processing ensures the removal of organic debris and contaminants, laying the groundwork for the subsequent sterilization process. To fully understand our topic, we must first know what is instrument processing and sterilization. So, instrument processing and sterilization refer to the procedures and techniques used to clean, disinfect, and sterilize medical instruments to ensure they are free from microorganisms and safe for reuse in healthcare settings. Let us begin by understanding the cornerstones of infection control. In the next slide, we will show more about the proper instrument process.
What is instrument processing? It is the process of proper instrument cleaning, packaging, and sterilization in order to maintain infection control in a dental clinic. This process will aid in ensuring the safety of patients by reducing the risk of cross-contamination and infection transmission. And here are the steps. An instrument or device can't be sterilized if it isn't clean. Therefore, the first step in instrument processing is cleaning. First thing is, number 1, pre-soaking. After use, submerge instruments in a designated container filled with an enzymatic or detergent-based solution to prevent debris from drying and adhering to the surfaces. Manual cleaning. After pre-soaking, manually clean the instrument using a soft brush and appropriate cleaning solution. Ultrasonic cleaning. Place the instruments in an ultrasonic bath filled with a cleaning solution, following the manufacturer's instructions. And last is inspection. After cleaning, visually inspect the instruments to ensure that all visible debris and contaminants have been removed. The second step in instrument processing is instrument packaging. This is essential in maintaining sterility after the sterilization process. The selection of packaging materials, packaging technique, and packaging integrity will serve as guidelines. It is a must that we use FDA-approved sterilization pouches, wraps, containers suitable for the sterilization method being employed. Ensure that the instruments are arranged in a manner that facilitates proper sterilant penetration and ease of use during subsequent procedures. Make sure that the packaging of instruments will be checked for any defects, tears, or compromised seals. After instrument packaging comes the crucial part of making sure that there will be no cross-contamination, and that is sterilization.
So what is sterilization? It destroys all microorganisms on the surface of an article or in a fluid to prevent disease transmission associated with the use of that item. The common methods used are steam heat, ethylene oxide gas, or chemicals. Here are different techniques of sterilization. First, autoclaving. Utilize steam autoclaves for most dental instruments. There are also chemical sterilants and biological monitoring. In chemical sterilants, some items, like certain handpieces, may require chemical sterilization. For biological monitoring, regularly perform spore testing to validate autoclave efficiency. Lastly, there is ethylene oxide sterilization. This is suitable for heat and moisture-sensitive instruments and should be performed in a designated area adhering to strict safety protocols. Now let's continue. In instrument processing, it is also important that we keep records of the sterilization of instruments. That's why it is crucial that we have sterilization records. The record must include the date, time, sterilizer used, cycle parameters, and operator's initial. It is important that we maintain accurate sterilization records to comply with local regulations and guidelines.
Let's proceed. The importance of adherence through protocols. Professional organizations provide guidelines and standards for infection control in healthcare settings, such as the dental clinic. That's why it's essential that we maintain a safe environment, and the dental clinics that adhere the protocols will eventually show their commitment to patient safety and quality care. Let's explore the following infection control protocols in dentistry is crucial for several reasons. So, what it is. It is a patient safety, healthcare worker protection, compliance regulation, prevention of cross-contamination, public trust, preventing outbreaks, professional reputation, and cost-effective, ethical responsibility, and lastly, the global health impact. On the next page, you can see an example picture illustrating patient safety. On the primary reason for adhering to infection control protocols in dentistry is patient safety. By strictly following these guidelines, dental clinics can prevent the spread of infections, ensuring the well-being of patients during various dental procedures. Healthcare worker protection. Beyond patient safety, these protocols are designed to safeguard the health of dental professionals by minimizing their exposure to infectious agents. Adherence to protocols play a crucial role in protecting the well-being of healthcare workers and dental setting. Compliance with regulations. Dental practice are not only committed to providing quality care but are also obligated to comply with health regulation and standards. Adhering to infection control protocols ensures the legal compliance, reinforcing the trust between healthcare providers and regulatory bodies. Prevention of cross-contamination. Strict adherence to infection control protocols prevent cross-contamination between patients. This reduces the risk of transmitting infection within the dental office and contributes to maintaining a sterile environment. Public trust. Patients place their trust in healthcare providers who demonstrate a steadfast commitment to infection controls. This commitment fosters confidence in the dental practice, creating a positive patient experience. Preventing outbreaks. Following protocols isn't just about individual safety. It's also about community well-being. By preventing outbreaks of infectious diseases, dental clinics contribute significantly to public health and community welfare. Professional reputation. Maintaining high standard of infection control enhances the professional reputation of dental practices. A good reputation attracts and retains patients, showcasing the clinic as a reliable and responsible healthcare provider. Cost-effective. Prevention is more cost-effective than dealing with the consequences of infections, including the potential legal and financial repercussion. Ethical responsibility. Healthcare professionals carry an ethical responsibility to prioritize patient safety and public health through effective infection control practices. This duty extends beyond regulation to core values of the professions. And lastly, global health impact. Effective infection control and dentistry contributes to global efforts in reducing the spread of infectious diseases, aligning with the broader public health goals.
There's causes and effects if we practice inadequate sterilization to our instruments. Let's talk about the causes first. Lack of infection control can lead to the cross-contamination of dental instruments and surfaces, increasing the risk of spreading infections between patients. Second is, failure to implement proper sterilization practices may result in the survival of pathogens on instruments, posing a threat to patient safety. Third is, inadequate hand hygiene among dental staff can contribute to the transmissions of infections from one patient to another. Fourth is, improper cleaning procedures may leave residual debris on instruments, creating a breeding ground for pathogens. Fifth, failure to use appropriate personal protective equipment or PPE such as gloves, masks, and eyewear increases the chances of exposure to bloodborne pathogens. Now, let's proceed to the effects. So, these are the effects. Let's start with patient infections. Without infection control measures, patients are at higher risk of contracting infections, including bloodborne diseases like hepatitis and HIV. Next is healthcare worker infections. Dental staff may be exposed to infectious agents, leading to occupational infections and compromising their health. Next is legal consequences. Neglecting infection control protocols can result in legal repercussions, including lawsuits for malpractice and violations of health regulations. Next is damage to clinic reputation. Reports of infections linked to a dental clinic can severely damage its reputation, leading to a loss of trust among patients and the community. Next is regulatory penalties. Health regulatory bodies may impose penalties or sanctions on dental clinics that fail to adhere to infection control standards. Next is financial impact. Outbreaks of infections linked to a dental clinic can lead to financial losses due to legal expenses, decreased patients' flow, and potential closure. Next is spread of communicable diseases. Inadequate infection control can contribute to the community spread of infectious diseases, especially in the case of highly transmissible pathogens. Next is increased healthcare costs. Treating infections resulting from poor infection control increases overall healthcare costs for affected individuals and the healthcare system. Ensuring robust infection control measures is crucial for safeguarding both patient and staff health, maintaining clinic reputation, and meeting legal and regulatory requirements.
Now, let's talk about an example that happened in real life. An experienced and renowned oral surgeon in Oklahoma, Dr. Scott Harrington, faced a scandal in 2013 when authorities decided to investigate his clinic after a patient with no risk factors tested positive for hepatitis C. There, they discovered several violations of hygiene and infection control standards in his clinic. So just imagine if you were one of his patients, what would you do? Moving on, state health officials urged 7,000 of his patients to get tested, and results claim that approximately 90 patients have been tested positive for hepatitis C, 6 for hepatitis B, and 4 for HIV. The officials announced that his clinic was found unsanitary with rusted instruments, improper sterilization procedures, lack of infection control measures, and disorganized drug cabinets with expired medications. He eventually surrendered his professional license in 2014 after more than 35 years in practice after facing several lawsuits from his former patients. If dental instruments are not thoroughly cleaned and sterilized, there is a great risk of being infected. So, do you want to get infected with this type of diseases? With all that, let us proceed on what are the other diseases that comes with lack of infection control aside from what we hear on the story.
So, if dental instruments are not truly cleaned and sterilized, there's a great risk of being infected by this. So, what is that diseases? So, it's a hepatitis B and C, HIV and AIDS, Staphylococcus infection, tuberculosis or we call TB, and herpes simplex virus, gastrointestinal infection, and lastly, respiratory infection. So, what is hepatitis B and C? These viral infections affect the liver, can be transmitted through contaminated blood on insufficiently sterilized instrument. HIV and AIDS, the human immunodeficiency virus, can be transmitted through blood or other bodily fluids. Insufficient sterilization may contribute to its spread. Staphylococcus infection. Staphylococcus bacteria, including methicillin-resistant staphylococcus, can cause skin and soft tissue infection, and they may be transmitted through contaminated instrument. Tuberculosis, or we call TB. Although TB is a primarily an airborne disease, improper sterilization practices can be contribute to the transmission Mycobacterium tuberculosis through contaminated instruments. So, let's proceed. Herpes simplex virus, or HSV. Herpes virus says, including HSV, can cause oral genital infection, and improper instrument processing may be contribute to the spread of these viruses. Gastrointestinal infection. Various bacterial and viral agents causing gastrointestinal infection, such as Salmonella or E. coli, can be transmitted through contaminated instruments. So, let's proceed. Herpes simplex virus, or HSV. Herpes virus says, including HSV, can cause oral genital infection, and improper instrument processing may be contribute to the spread of these viruses. Lastly, the respiratory infection. Respiratory infection is a pathogens causing respiratory infections such as Streptococcus pneumonia and Haemophilus influenzae. May be transmitted if respiratory care instruments are not properly sterilized.
Autoclave is the most used in sterilization. So, why is it most used in sterilization? Autoclaving is highly effective in killing bacteria, viruses, fungi, and spores. The combination of high temperature, typically 121 to 134 degrees Celsius, and pressure penetrates and destroys a broad spectrum of microorganisms. Autoclaves can sterilize a wide range of materials including instruments, glassware, surgical equipment, and more. It is a versatile method applicable to various items used in dental and medical practices. Here are the steps of autoclaving. First, preparation of items. Ensure the items to be autoclaved are suitable for sterilization under high pressure and heat. Most heat-resistant materials such as glass, metal, and certain plastic can be autoclaved. Check that items are free from contaminants and residues. Second, loading the autoclave. Place the items to be autoclaved in autoclave-friendly containers or pouches. Proper arrangement is essential to ensure steam penetration and effective sterilization. Third is adding water. Add distilled or deionized water to the autoclave. The water is necessary to generate steam during the autoclaving process. Fourth, closing autoclave door. Ensure that the autoclave door is securely closed. Many autoclaves have locking mechanism to prevent accidental opening during operation. Fifth is setting parameters. Set the desired parameters on the autoclave control panel. This includes the temperature, pressure, and sterilization time. The specific settings will depend on the items being sterilized and the autoclave model. Sixth step is venting. Before the actual sterilization process begins, the autoclave may go through a venting paste to remove any air from the chamber. This helps to ensure that the steam can be penetrate effectively. The seventh step is commencing sterilization. Start the autoclave cycle. The machine will raise the temperature and pressure to the preset levels. The combination of high pressure and steam is effective in killing bacteria, viruses, and other microorganisms. Eighth step, sterilization time. Maintain the preset temperature and pressure for the recommended sterilization time. This duration is crucial for achieving complete sterilization. The ninth step is cooling paste. Once the sterilization cycle is complete, the autoclave may enter a cooling phase. This helps to bring the temperature and pressure back to safe levels before the door can be opened. After the cooling phase, open the autoclave door carefully. Be cautious of the hot steam that may still be present. Carefully remove the sterilized items from the autoclave. Use appropriate equipment such as heat-resistant gloves and tongs. Then check the autoclave items for any signs of damage or contaminations. Some autoclaves also have built-in indicators that change color to confirm successful sterilization. Reminder: always follow the specific guidelines provided by the autoclave manufacturer and any protocols established in your laboratory or facility. It's important to ensure the safety of both the operator and the items being autoclaved. In the next slides, we will show you a video of how autoclaving is done.
This video is about the basic sterilization equipment most commonly used, top loading autoclave. We're going to discuss its working principle, parts, directions to use, and potential hazards. This autoclave works on the principle of moist heat sterilization. High pressure inside the chamber increases the temperature of water to generate steam for the sterilization of instruments. The higher pressure also ensures rapid penetration of heat inside the drum to sterilize. The moisture present in the steam causes coagulation of proteins of microbes, causing irreversible loss of their activity and functions. The parts of top loading autoclave are safety valve, pressure gauge, pressure regulating device, lid, lid handle, body of autoclave, body handle, steam releasing valve, rotary timer, and black steel stand. To open the autoclave, turn the lid anti-clockwise. As you feel the unlock, lift the lid up. This is the stainless steel drum. Inside the autoclave, there is a stand for the stainless steel drum and the heating element. First, place the stand inside the chamber. Now submerge the chamber with distilled water. Then keep the instrument inside the green cloth and then place the green cloth inside the drum. And place it inside the autoclave chamber. Before closing the lid, make sure that the steam releasing valve is open. Make sure that the rubber gasket is not damaged from anywhere and is tightly sealed. Now for closing the lid, turn the lid in clockwise direction. Now close the steam releasing valve. Now connect this cord with the socket of heating element. Now connect the power cord. Now set the rotary timer. Now check on the pressure gauge, it has come to 0. Now remove the lid by turning it anti-clockwise. Now the instruments are sterilized and ready to use. Sterilization is a method indispensable in a dental clinic. So is an autoclave. But carelessness or mishandling could lead to accident or unpleasant experiences. Worst of them all could be a blast or explosion of the autoclave. A few things, if kept in mind, could avoid such accidents. Explosion may occur when the lid is not sealed properly or the rubber gasket is old or damaged. Ensure the pressure regulating device is working fine to stabilize the pressure inside and also monitor the pressure gauge. The pressure and the heat inside the chamber might rise and escape rapidly if not balanced, causing an explosion which could prove fatal. Few other hazards are burn hazard. Be cautious of hot surfaces when loading and unloading autoclave. Recently, autoclave contents inside will be extremely hot. Make sure to keep your face, body, hands away from the escaping heat and steam when opening the lid of an autoclave. Well, that's all we have for today. Thanks for watching.
So the key takeaways of this presentation includes ensure patient safety and healthcare worker protection, compliance with regulations, prevention of cross-contamination, and building public trust. Causes include cross-contamination, inadequate sterilization, poor hand hygiene, insufficient cleaning, and lack of PPE. Effects involve patient and healthcare worker infections, legal consequences, damage to clinic reputation, regulatory penalties, financial impact, and increased healthcare costs. Maintain accurate records of sterilization cycles, include date, time, sterilizer used, cycle parameters, and operators' initials. Use FDA-approved sterilization pouches, wraps, or containers. The issue involving Dr. Scott Harrington serves as a real-life example of the possible consequences of insufficient infection control, and transmissible diseases such as hepatitis, HIV or AIDS, and respiratory infections pose significant risk in the absence of proper sterilization practices.